जी वेलकम व्यूअर्स। माई सेल्फ डॉक्टर सारंग सुरेश। और आज हम एक केस डिस्कस करेंगे जो मैंने रिसेंटली इंस्टाग्राम पे अपलोड किया था और एक क्वेश्चन छोड़ा था कि इसका डायग्नोसिस और मैनेजमेंट बताएं। तो उसका आंसर यहाँ पे भी इस वीडियो में मैं डिस्कस करूँगा। केस ये है कि एक 10 साल की फीमेल है बच्ची जो मदर के साथ प्रेजेंट हुई है ओपीडी में। उसकी कंप्लेन थी that there is a black discoloration on the teeth since 2 months. On asking the dental history and other medical history, her mother denied any kind of the drugs used by this patient or any kind of any other bad oral hygiene methods, just like smoking or any kind of colored products usage by the child. She is not taking any kind of drugs. She is currently quite fit and well. There is no any history of hospitalization. There is also no any kind of discoloration present in the siblings, nor she is from the area which has the high fluoride level, which could lead to a suspect about the fluorosis. So there in the clinical picture we are seeing that there is a black discoloration involving the incisal edges of the all the surfaces in the maxilla and in the mandible. The black discoloration is present at the middle third of the tooth, and at the molar region the black discoloration is present at the cervical aspect of the teeth. There are few teeth which are still in the erupting phase, just like here at the canine and premolar region, and in the right side too. There is a arrested kind of carious lesion in the mesial aspect of the first molar, and we can appreciate presence of the plaque and calculus at the cervical aspect of the all the teeth in this child. On inquiring about the dental history, we found that she does not brush since long time, and brush occasionally within a month or two, and is not frequent since 2 to 3 months she has not brushed her teeth. So this is currently the clinical picture, and we will discuss about the differential diagnosis now, and then the management options, and what could be the diagnosis about this, and what is the management for this condition, what is the mechanism of this condition. So the differential diagnosis for this condition is extrinsic staining, which could be from the chromogens, because these are the chemical compounds that convert to colored compounds. If the patient is having increased tea and coffee consumption, it can cause the black and brown staining. And if the patient is smoker, it can also lead to black discoloration. Poor oral hygiene can result in the yellow, brown or green discoloration, which is suspected in most cases in this patient because she is not having any kind of colored product, she is not fond of tea and coffee, she is not smoking. Yes, excess amount of chlorohexidine mouthwash can cause the black and brown stains, and also the iron supplements can lead to the black discoloration, but she is not taking any these kind of products. Another differential diagnosis is the intrinsic staining, which could be due to amelogenesis imperfecta, dentinogenesis imperfecta, tetracycline staining, but the clinical picture is not matching with these kind of diagnosis, and the patient siblings does not have any kind of problems. Other is caries, but the caries cannot be visualized with these kind of powdered appearance. So let's discuss about the etiology of black staining. Black stains generally results from the plaque which is prone to calcification. The most common bacteria involved in these kind of stains are the Actinomyces and Prevotella melaninogenica. And the black pigmentation occurs because the bacterial plaque contain the ferric salts such as ferric sulfide. The ferric sulfide is formed between the hydrogen sulfide, which is produced by the plaque bacteria, and the iron in the saliva or gingival exudate, which produce this kind of black pigmentation. In research, there are different classifications for the differentiation of these kind of stains. The first classification is the one in which your type 1 stains are pigmented dots with thin line and incomplete coalescent parallel to the gingival margin. This patient has these kind of stains at the molar region. And class 2, type 2 is continuous pigmented lines limited to half of cervical third up to surface. And type 3 is the pigmented stains extending beyond the half of cervical third. Generally, this patient has almost all three kind of stains present in different areas of the teeth. So we cannot generally classify exactly in which, but for the research purpose, these classifications are given to estimate the prevalence of the black stains. Another classification is class 1, in which there is no any kind of line present, class 2 in which incomplete coalescence of the pigmented spots, and class 3 continuous line formed by the pigmented spots. Similar, this second classification is also present in different teeth of this patient, so we cannot classify exactly which type of black staining this patient is, but we can just diagnose it with the black staining. So the management for this patient would be, first we have to diagnose the black stain, and in the diagnosis it means we have to identify the cause of staining. The cause of staining in this patient was poor oral hygiene, did not brushing her teeth. And step 2 is to reassure the patient that it is not any kind of permanent kind of staining, it can be removed, but we have to make sure and tell them that it can be recurrent if the patient is not brushing her teeth. We have to also advise to avoid excessive hard brushing to remove these kind of stains, because these stains would not be removed easily with the toothbrushing alone. And simple scaling and polishing is advised to remove these kind of stains. We should not use the ultrasonics or at the tooth surface, and we can just remove these stains with the polishing brush and prophy jets. We have to avoid iatrogenic damage by preparation or using the handpiece to prepare the cavity and restore with the restoration. No need of these kind of things. But we have to advise the patient they can reoccur, and if the patient is avoiding brushing or doing any kind of bad oral hygiene products, consuming excessive colored products, and if the recurrence occur, we can just repeat the same procedure again and treat this condition. So that's all about this case. I hope you got some evidence based information from this. If you are new to our channel, just subscribe and hit the bell icon. Thank you.